Where do public health professionals work? Today, we'll discuss 5 traditional public health work settings, give some examples of organizations that fall under these 5 categories, and look at the common themes that you may encounter when working in one of these areas. First are hospitals or healthcare settings. When working in a hospital, you're likely to work with many different healthcare providers. You could work in infection prevention or be a lab scientist. You could also be running clinical trials as a research coordinator or analyzing hospital data or project data as an epidemiologist. Clinics are also popular settings for public health professionals to work in. You could be working at a free clinic providing preventative services to the community. Another common role seen in clinics and free clinics are community navigators or community health workers. These are public health professionals who provide information on local and accessible resources to the community. Disease prevention and control is really at the forefront of your work in healthcare. This includes developing vaccination campaigns, tracing disease spread, implementing screenings, and managing outbreaks. This is also the underlying theme of public health, but in the healthcare setting, you'll be in that direct line of work. You're also likely to be involved in community engagement. Building partnerships and mobilizing communities is crucial for developing and implementing effective health programs. As mentioned earlier, working in healthcare settings means you'll be in a diverse team of healthcare providers and administrators, so teamwork is a major theme, as well as communication. And overall, people or patient-centered care is the main priority. Next up, we have government. There are several public health government agencies at the federal level here in the U.S., working in environmental health or food and drug safety, or at the Centers for Disease Control and Prevention. You could also work in a variety of areas at your state health department and even in your local health department. Many local and state governments get to work on strategic plans that involve the community health and well-being of their specific town or region. So by working at the local or state government level, you could possibly work on these plans, whether it be condition or topic specific like asthma or a general public health plan. You could have the opportunity to work in reportable disease surveillance, getting to track infectious diseases like tuberculosis and Ebola, and non-infectious diseases like cancer. Another role is working in the actual government legislature as a political aide or staffer. So staffers prepare the reports, conduct the research, draft the legislation, and prepare the negotiation briefs that allow political life to go on. Political aides may very well be an effective resource to politicians about public health insights, leading to newly developed health legislation. Rather than direct patient or individual level care, government level public health work focuses on systems level change. That is, the structures, policies, relationships, and surveillance tools that transform how a whole system, such as a government agency or even whole government, operates for lasting impact. You're also going to have a population-wide focus. So if you work at the New York City Health Department, your main focus is the residents of the city, whereas a state government agency works to serve the people of that state. There's a lot of cross-sector collaboration in government. You can be working among different public health agencies. So for example, different state health agencies could be working together, or you could be working with local governments, academia, especially if they're your partners or contractors of a project or grant, or you could be working with departments within your same agency. This deserves a separate video on its own, but public health in the US has seen unprecedented times this year because of policies, and it really goes to show that everything is political, and it shapes the funding that your agency receives, the data made available to you, censorship, etc. Next up is working at an academic institution, either at an undergraduate university or graduate school. Common roles are research coordinators, epidemiologists or data analysts, and even clinical jobs like community health workers or public health nurses working on community outreach projects. Let's say you have a professor at the school whose research interests are breast cancer prevention, and she's been awarded a grant to implement mobile mammographies across the community in order to increase access to care. That professor may need several program staff for her project. Perhaps a public health nurse to help the physicians with the screenings, a program evaluator to collect and analyze data, and a grant specialist. This is just one of the many project examples that you could be working on, as professors have different research areas of interest, and many professors are working on several projects. Since you're most likely going to be working in a setting with multiple professors working on many different grants, there will be many opportunities to learn and grow, both within those projects and outside, such as taking trainings, going to conferences, and connecting with people at your institution. Academia is largely research-focused, with the purpose of creating evidence-based interventions, answering hypotheses, and working on projects that result in manuscripts, reports, or other media that contributes to the array of knowledge in the topic or field you're working on. Also in academia, you really do have a regional impact in your work, and many of the times the projects that you work on are connected to an affiliated clinic or part of town that the university is in. And with newly hired staff and professors, new student cohorts each semester, beginning new projects and ending others, there's always change happening. Many times there will be periods where you need to learn new softwares for projects and take trainings in order to be up to date on the institution's procedures. On to nonprofits. Nonprofits in public health are mission-driven entities serving community health through services, research, care, and advocacy. Nonprofits champion health equity, pushing for better policies, and educating the public and policymakers. These organizations have always been crucial for advancing public health practice and creating change, and have been instrumental in 2025. They're purpose-driven, so they align with personal passion in improving community health, well-being, and addressing inequities. Many times, nonprofits focus on one public health issue, which is pretty neat. And as mentioned, they're involved in policy and advocacy, so engaging with government and officials to secure resources and influence policy is a major part of the work nonprofits do. They're also centered on kindness, equity, and advocating for human rights and health. Nonprofits are instrumental in providing direct care, screenings, health education, and connecting individuals to services. Last up, we have the private industry. And yes, you'll see organizations of all kind, because at the end of the day, every aspect of our lives involves public health. So maybe you're a clinical research coordinator at Pfizer working on safe and effective vaccine development in order to ensure that providers and the public have access to vaccines that protect against diseases. Or maybe you're a data analyst involved in aviation safety at United Airlines. And yes, I actually saw this role pop up on my LinkedIn recently. A big difference from the previous four sectors that private industry tends to exemplify is higher pay for its public health employees. That's because they may have direct investment or other models for leveraging capital for health initiatives, contrasting with government work, which are often grant-funded public projects. Private industry also has a lot of innovation and technology, developing new tools and platforms such as health apps or data analytics softwares. Because of these additional resources, private companies may be quicker to adapt to community needs, offering diverse and personalized services unlike public systems. Lastly, they also collaborate with government and other organizations by sharing resources such as expertise, funding, and data to achieve shared health goals. That was our overview of 5 public health sectors. Thanks for watching!